These are the 6 important topics we study under the main heading temporal and infratemporal region. In this session we are only covering the temporal and infratemporal fossa. So what do you mean by fossa? What is the definition for fossa? Okay, fine. Any other point? Pardon? Impression. Okay, fine. First we will start with the temporal fossa. The temporal fossa lies on the side of the skull and is bounded by the superior temporal line and the zygomatic arch. Osteology of skull is finished, right? Can you identify the features in the skull now? No? Okay, nice. So what is this bone called? Okay, this one? Temporal. What about this bone? This point or this part? Okay, fine. What about this bone? Occipital. Okay, fine. Can you see this part? What is that called? What bone? Okay. What about this point where I am keeping my finger, this point? What bone it is called? This is your frontal bone. I can say this part is your parietal bone and this is your zygomatic bone and this is occipital bone, right? And this we call it as, okay. What about this point? What is this called? What? Mastoid? Okay. This one? This point? Styloid process. Okay, fine. So, this is the zygomatic arch. The fossa what you are seeing here is your temporal fossa, okay, and this fossa what you are seeing here is the infratemporal fossa. I can say your temporal fossa is present above the zygomatic arch and the infratemporal fossa is present below the zygomatic arch. So, the zygomatic arch is the communication that present between your temporal and infratemporal fossa, okay. The boundaries of your temporal fossa, anteriorly it is bounded by zygomatic and frontal bones, posteriorly it is bounded by inferior temporal line and also by the supramastoid crust, superiorly it is bounded by superior temporal line and inferiorly it is bounded by zygomatic arch. Where you can see the inferior temporal line and superior temporal line? Can you see the lines here in this particular bone? Can you identify the line structure? No? Okay. If you get the old skull part, can you identify it? Can you identify the inferior temporal line and superior temporal line? Both of you come here please. So, all of you help your friends to identify the structures, okay? Can you use this now? Can you use this? Okay. You use, take this. You just point it, your friends will answer. Okay, next. Go for this. This one. Yeah. What is that bone called? Temporal bone. Okay, fine. And what is this bone called? What is this bone called? Sphenoid bone. Which part of sphenoid bone? There are few parts. This one is greater wing of the sphenoid bone. Okay. Turn. This is the greater wing of your sphenoid bone. What about this bone? So this is your zygomatic arch. What about this point? Mastoid. This one. This point. Turn it to the front. What about this bone? Stop talking. You will be the next one to stand here if I saw you once again speaking to your friend. What about this bone? This one? What is this is called? This part is called? Okay. Can you hold it like this? This part is called? What is this called? You stand that side. Can you hold it like this? Okay. So here you all can identify the zygomatic arch. The fossa that is present above your zygomatic arch is called temporal fossa, and the fossa that is present below the zygomatic arch is called infratemporal fossa. The boundaries are given there. Your temporal fossa anteriorly bounded by the zygomatic bone and also by the frontal bone. So can you identify the zygomatic and frontal bone here? Hold it like this. So this is the frontal. What is this? Temporal fossa, right? This point. This is your temporal fossa. Anteriorly it is bounded by frontal bone and zygomatic bone. So which one is the zygomatic bone? This is your zygomatic bone and this is the frontal bone. Okay. Next, posteriorly it is bounded by inferior temporal line and the supramastoid crust. We can identify the supramastoid crust in this specimen or in this bone, and we can see the inferior temporal line in that one. So can you identify the supramastoid crust in this one? Where we can see the supramastoid crust? Where? Here. Okay. Others? Supramastoid crust. So this part, this is your mastoid process, right? If I put my thumb region here, this is your supramastoid crust part. Okay. I am not sure whether you all can see or not. There are few empty seats. You can come and sit here also. Okay. Later don't complain that you didn't saw or you didn't understood anything. So this is your supramastoid crust part. Okay. And inferior and superior line. So I will start from this region. Okay. So from here we will have the superior temporal line. Okay. Below the superior temporal line we will get, from this region we can see the inferior temporal line. If we have this original skull, like real skull, we can see those lines. Here it is not mentioned, so I am just passing my thumb. This is your superior temporal line part and this is your inferior temporal line part. Okay. Next, superiorly it is bounded by superior temporal line. At last, that is inferiorly it is bounded by your zygomatic arch part. So which one is the zygomatic arch? Now show it to them. So inferiorly it is bounded by the zygomatic arch. These are the boundaries of your temporal fossa. When we are studying the fossa, we will study under three main topics. The first one is boundaries, the second one is communication, the last one is contents. Okay. These four are the boundaries of your temporal fossa. Talking about communication, your temporal fossa have only one communication, that it communicates with the infratemporal fossa through the zygomatic arch. Okay. What are the contents we see in the temporal fossa? So, what are all the contents? Contents of zygomatic arch. You can just randomly name any structures you know from these part. What are all the contents of temporal fossa? Okay. Contents of the temporal fossa, it has temporalis muscle which is covered or protected by a temporal fascia. Next we have middle temporal artery, deep temporal nerve, and also zygomatico-temporal nerve and artery. We have deep temporal artery which is a branch of maxillary artery. So, the contents include one major muscle, that is your temporalis muscle, which is covered by the temporal fascia. We have three important arteries. The first one is middle temporal artery, deep temporal artery, and the zygomatico temporal artery, and we have two important nerves. The first one is zygomatico temporal nerve and another one is deep temporal nerve, which supplies to your temporalis muscle. Okay. These are all the contents, communication and boundaries of your temporal fossa. Any doubts in this? Any doubts? No doubts? Okay. You both can explain it now. Just explain it once and go back to your place. First show them the temporal fossa.
This is the temporal fossa.
Can you just put this marker there? This is the temporal fossa.
This is the temporal fossa. This one.
Okay, that is the temporal fossa. What about the boundaries? Show them the boundaries. Anteriorly it is bounded by zygomatic bone and frontal bone. You should help your friend.
Zygomatic
Bone. This is the zygomatic bone and this is the frontal bone. Okay, and posteriorly it is bounded by what structures? Inferior temporal line and supramastoid. Show them the crust, supramastoid crust. This is the supramastoid crust. Okay. Next, superiorly it is bounded by superior temporal line and inferiorly it is bounded by which structure? Zygomatic arch. This is the zygomatic arch. Communication, it communicates with your infratemporal fossa. Okay. Contents, we have one important muscle, temporalis muscle, and what are the three arteries? Middle temporal artery, deep temporal artery, and okay, what about two nerves? We have zygomatico-temporal nerve and deep temporal nerve. These are the contents of your temporal fossa. Is it clear for everyone? Any doubts in this topic, temporal fossa? Okay. You can see the structure. This point is called pterion. It is a very important structure. Once they discuss about the osteology of skull, you will get to know about it. But right now remember the name pterion. Okay. Then this is your frontal bone, this is your parietal bone, and you can see here this is your superior temporal line, and the next one is your inferior temporal line. These are the lines which I was mentioning. Okay, you can see those lines in the real skull. Okay, next we have, what is this bone? And this one, this is your occipital bone. Okay, any doubts in this? Next we have infratemporal fossa, which is present below your zygomatic arch. Okay, the infratemporal fossa is the space beneath the base of the skull, between the side wall of the pharynx and also on the ramus of the mandible. It communicates with the temporal fossa through a gap deep to the zygomatic arch. It is also referred to as the parapharyngeal space or lateral pharyngeal space. First we will start with the boundaries. Roll number 43. Okay. Next roll number 147. Come. Both of you come. Don't waste the time, just come here. So the boundaries of your infratemporal fossa, roof is formed by the infratemporal surface of the greater wing of the sphenoid bone, and it is pierced by the foramen spinosum and also by the foramen ovale. We will talk about the foramen part later. Right now we will concentrate only on the bones part. Okay. So the roof of your infratemporal fossa is formed by the greater wing of the sphenoid bone. Can you both show the sphenoid bone to your friends? Just stand here. No, that is eye orbit. Where is the sphenoid bone? Help your friend. No, this is sphenoid. This is sphenoid. Show it to them. So that is the sphenoid bone. It forms the roof of your infratemporal fossa. Okay. Medial wall is formed by the lateral surface of the lateral pterygoid plate of the sphenoid bone again, and lateral wall is formed by the ramus of the mandible. Can you show them the ramus of the mandible? Ramus of the mandible, see that third point. Show it to them, not me. Is it right? So where is ramus of the mandible? Can you hold like this? Ask them, your friends. Is it right? Is it right? Yes. Sure? Others? Is that the ramus of mandible? Okay, fine. Next we have anterior wall. It is formed by the infratemporal surface of the maxilla bone. So which is the maxilla bone here? Show it to them. Is it right? This is the maxilla. It forms your upper jaw part, mandible forms the lower jaw part. Okay. So your anterior wall is formed by the maxilla bone. Okay. Next, floor it open and extends up to the level of the base of the mandible, and posterior wall is formed by the styloid process of your temporal bone. So show them the base of the mandible, which is the base of the mandible. You just show it to your friends, please. Which is the base of mandible, guys? Which one? Is it right here? Is it right? No? Is it right? So where is the base of the mandible? Mandible also not finished, osteology. Mandible, maxilla. Okay, at least while discussing the difference between male and female skull part, what are all the points they have mentioned? Anyone? Anyone from that row? What points you have discussed in the difference between the male and female skull? Anyone from this row? Last table? Stop talking. Do you all have textbook at least? Yeah. Open it and see. Osteology chapter, base of the mandible, ramus of the mandible. Just open the diagram of mandible. So which one is the ramus of the mandible? The side part. Show it to them. You hold this. Show it to them. Is it right? No? Which one? That is the ramus of the mandible. What about the base of the mandible? Can you hold it little up so that everyone can see? Is it right? Base of the mandible. Others? No? Is it right or not? Okay, fine. So the roof of your infratemporal fossa is formed by the sphenoid bone. Medial wall is also formed by the sphenoid bone, but by the lateral pterygoid plate of the sphenoid bone. Okay. Lateral wall is formed by the ramus of the mandible. Anterior wall is formed by the maxilla bone. Floor is formed by the base of the mandible, and posterior wall is formed by the styloid process of the temporal bone. So which one is the styloid process of the temporal bone? You can show in that one also. This one. This is the styloid process. This one. So that is the styloid process, right? What about this process? This is the mastoid process, and what is this structure called? Where I have kept my thumb part, it is called supramastoid crust part. Okay. These are the boundaries of your infratemporal fossa. Is it clear for everyone? Any doubts in this? Okay. You can see the diagram here. This shows the boundaries of your infratemporal fossa. Okay. Next, communication I will discuss later. First we will see the contents of your infratemporal fossa. We have three important muscles, that is lateral pterygoid muscle, medial pterygoid muscle, and tendon of the temporalis muscle. Okay. Then blood vessels, we can see maxillary artery, maxillary vein, and pterygoid venous plexus. Nerves, that is mandibular nerve, chorda tympani nerve, and aortic ganglia. I already mentioned in the temporal and infratemporal region chapter, maxillary artery, mandibular nerve, aortic ganglion, TMJ, that is temporomandibular joint, with your temporal and infratemporal fossa are the important topics. And these muscles, that is temporalis muscle, lateral pterygoid and medial pterygoid muscles are called, they are collectively called muscles of mastication. Is it finished in dissection, muscles of mastication? Not finished? Okay, fine. So, these are the few important contents we see in the infratemporal fossa. Next we have communication. Before talking about communication, we have to know about few foramens that present in the base part of your skull region. Okay. So, can you see these openings here? Can you see the openings? Can you see this opening and here? These are called foramens of the skull region. Okay. What is this foramen called? It is called foramen magnum. Okay. Do you know any other foramen? Any idea about foramen ovale, foramen spinosum? Do you know how we divide this region into? Anterior cranial fossa, middle cranial fossa and posterior cranial fossa. This is how we divide this entire part into. Okay. This part where you are seeing this front part from here to here, this is called anterior cranial fossa, and this region is called middle cranial fossa, and this region is called posterior cranial fossa. Your foramen magnum is present in the posterior cranial fossa. Okay. In the middle cranial fossa, we have 7 openings or 7 fossas present, but regarding this topic I am only discussing about 2 important fossa. Okay. That is foramen ovale and foramen spinosum. Okay. Any doubts in this? Any doubts in the boundaries and contents? No doubts? Fine. We both can. Okay. To know about the communication, we have to start from the zygomatic arch part. Imagine this is your zygomatic arch. Okay. Above the zygomatic arch we have temporal fossa, and below the zygomatic arch we have infratemporal fossa. So, your temporal fossa have only one communication, that is with your infratemporal fossa through the zygomatic arch. Your infratemporal fossa have 3 important communication. One is superiorly, and next one is anterior communication, and here I will mention about the medial communication. Okay. Superiorly, your infratemporal fossa communicates with which part? It communicates with middle cranial fossa. It communicates with your middle cranial fossa through 2 foramen. The first one is foramen ovale, and the second one is foramen spinosum. Foramen spinosum is smaller in size and foramen ovale is comparatively bigger in size. This is the identification point when you have a skull. Okay. And anteriorly your infratemporal fossa communicates with the eyeball part. Okay. Through which structure? Through which structure? Inferior orbital fissure. Okay. And medially your infratemporal fossa communicates with one more important fossa, that is called what it is called? Pterygopalatine fossa. Pterygopalatine fossa is a separate chapter. It is also a very important fossa present in your skull part or in your head region. Okay. It communicates with your pterygopalatine fossa through which structure? Through pterygomaxillary fissure. Maxillary fissure. Okay. And your pterygopalatine fossa also communicates with the eyeball part, again with the same structure, that is inferior orbital fissure. Okay. But here it is a medial aspect or towards the medial side. Here it communicates from the lateral aspect, that is the difference, and it is a MCQ question and you will be having clinical question on these points, so note it down. So we have zygomatic arch. Above the zygomatic arch we have a temporal fossa. Below the zygomatic arch we have infratemporal fossa. In this is a flow chart for the communication of your infratemporal fossa. Your infratemporal fossa superiorly communicates with the middle cranial fossa through two important foramens, that is called foramen ovale, which is bigger in size, and foramen spinosum, which is comparatively smaller in size. Okay. And anteriorly it communicates with the eyeball part through a opening called inferior orbital fissure in a lateral aspect or towards the lateral side. Okay. And medially your infratemporal fossa communicates with pterygopalatine fossa through a opening called pterygomaxillary fissure. Okay. These are the important communication of your infratemporal fossa. Any doubts in this? Any doubts? There are different flow charts in different textbooks. So go and see the flow chart given in your textbook, whichever is easy for you, you can refer that, or you can draw this one also, no problem. So now in this structure I have already mentioned, this is the middle cranial fossa, right. So your infratemporal fossa is superiorly communicating with middle cranial fossa through two important foramen. So if you see here, there are two small hole like structures are present. The first one is bigger in size and the second one is smaller in size. Okay. The first one, which is bigger in size, is called foramen ovale, and the second one, which is smaller in size, that is called foramen spinosum. Okay. If we put a thread from this region, we can see that coming out from your infratemporal fossa part. Okay. Next we have infraorbital fissure, that is in the anterior communication part. So this is the eyeball region, right. So in this eyeball region you can see two openings here, one in this position and one in this position. One I can say like this and one like this. The upper one here which is present is called superior orbital fissure. Now here it is not connected or communicating with any part, we are only concentrating on the inferior orbital fissure. So here in this part we have inferior orbital fissure. Through this part it is communicating with your infratemporal fossa. Okay. Next we have medially, it is communicating with pterygopalatine fossa. So if you come closer and observe the specimen, we have a zygomatic arch, I can see the temporal fossa, and here I can see infratemporal fossa, right. So in this region next to this thread part, here we have one more small opening. Okay, that is nothing but your pterygomaxillary fissure. Through that fissure, if we trace it inwards or towards the inside of your skull part, we will get the pterygopalatine fossa. Later take the specimen and try to identify the pterygomaxillary fissure. Okay, it is right here in this position. Okay, this is your pterygomaxillary fissure. Temporal and infratemporal fossa is important topics for your osteology viva. Muscle of mastication will be important for your dissection part. Maxillary artery and mandibular nerve are important for your theory part. Okay, keep this point in your mind. So, any doubts in the communication part? Any doubts? Others, any doubt? No doubt? Okay. Then we'll, okay, you can see here, this is your zygomatic arch region. Here we have a temporal fossa and this is the infratemporal fossa, and this is the communication that is present between your temporal and infratemporal fossa part. And here I have mentioned about the temporal fascia, you can see here. Next to that, in this region you will see your temporalis muscles. Okay. This is the flow chart which is given in your Vishram Singh textbook. So, refer different textbooks, there are different flow charts, go for whichever easy for you. Okay. Okay. Next topic is muscles of mastication. For muscles of mastication, maxillary artery and mandibular nerve, I have added only few important points. The muscle of mastication are concerned with the movements of the mandible at the TMJ during mastication process. They are divided into two major groups. The first one is principal muscles, the second one is accessory muscles. The principal muscles are temporalis, masseter muscle, lateral pterygoid and medial pterygoid. Accessory muscles are digastric, buccinator, mylohyoid and genohyoid muscles. Okay. You can see here, this is your masseter muscle and this is your temporalis muscle, this is lateral pterygoid and this is the medial pterygoid muscle. These are the principal muscles of the muscles of mastication. Next, this is the origin, insertion, nerve supply and action of each muscles, which is important for your dissection part, for discussion. Okay. And observe this point, in your lateral pterygoid we have two head, the first one is upper head and the second one is lower head, and also in medial pterygoid we have superficial head and deep head. So, in both medial pterygoid and lateral pterygoid we will get two divisions. You can see here, this is your temporalis muscle and this is your masseter muscles, deep head, and this is the masseter muscle, superficial head. And this is your lateral pterygoid muscle. We have two heads here also. This is the upper head and this is the lower head. And this is your which muscle? Medial pterygoid muscle. It has a deep head and also the superficial head. Again, muscle of mastication, maxillary artery, mandibular nerve is a separate topic. Again, there will be discussion. These are just the basic topics. This session is mainly for temporal and infratemporal fossa. Okay. So, maxillary artery is the largest terminal branch of your external carotid artery. Your external carotid artery is a branch of which artery? Common carotid. So, your common carotid artery give two division, external carotid and internal carotid. Your external carotid artery will pass through which gland or enter into which gland? Your external carotid artery will enter into parotid gland. Inside the parotid gland, it will give the maxillary artery. Remember this point, okay? It arises behind the neck of the mandible and it runs horizontally forward up to the lower border of the lower head of the lateral pterygoid muscle. After emerging between the two heads of the lateral pterygoid muscle, it enters the pterygopalatine fossa by passing through the pterygomaxillary fissure. This part, pterygopalatine fossa and pterygomaxillary fissure. Here it ends by giving its terminal branches. The maxillary artery have a wide distribution. It supplies your upper and lower jaw part. It also supplies the muscles of temporal and infratemporal fossa, nose and paranasal sinuses, palate and roof of pharynx, external and middle ear, pharyngotympanic tube and also to your dura mater. Your maxillary artery is mainly divided into 3 parts. We call it as first part, second part and third part, and each part gives around 5 to 6 branches. So, you should know the name of all 5 or 6 branches of each part of the maxillary artery. Okay. The maxillary artery is divided into 3 parts by the lower head of the lateral pterygoid muscle. It is a MCQ question. First part, which is also known as mandibular part, it starts from the lower border of the lateral pterygoid and it lies between the neck of the mandible laterally, and it also supplies spinomandibular ligament medially. Second part is called pterygoid part. From it extends from the lower border to the upper border of the lower head of lateral pterygoid. That is the second part, it lies deeper to your lateral pterygoid muscle. The last part is called pterygopalatine part. It starts from the upper border of the lower head of lateral pterygoid to the pterygopalatine fossa part. Okay. You can see here, this is your external carotid artery. From here we have the first part, and this is the second part, and this is the third part. Okay. So, these are the branches of your maxillary artery. Your first part will give rise to 5 branches, second part will give rise to 4 branches, and last part will give rise to 6 branches. This will be your short answers question again. Mention the branches of third part of maxillary artery, or mention the branches of first part of maxillary artery. Like this they will ask question. It is a short answers, like 2 marks question usually. The last part is mandibular nerve. The mandibular nerve is the largest nerve of the 3 divisions of the trigeminal nerve. So, what are the divisions of trigeminal nerve? What are the divisions of trigeminal nerve? This is general anatomy topic. Optic, okay, maxillary, okay, maxillary nerve, mandibular nerve and ophthalmic nerve. Is it right? Is that the 3 divisions of your trigeminal nerve? Maxillary nerve, mandibular nerve and ophthalmic nerve. Go check it once and let me know in the next class. Okay. So, it is a mixed nerve. It consists both your sensory and motor roots or fibers. It is a nerve of the first pharyngeal arch. So, hence it supplies all the structures that derived from this first pharyngeal arch, that is the muscles of mastication. So, all your muscles of mastication, that is temporalis muscle, masseter muscle, lateral pterygoid and medial pterygoid are supplied by the mandibular nerve. Okay. Course and relation, it begins in the middle cranial fossa, has 2 roots, a large sensory root and a smaller motor root. The large sensory root arises from the lateral convex part of the trigeminal ganglion and immediately leaves the cranial cavity by passing through the foramen ovale to enter the infratemporal fossa region. The small root arises from the pons part, that is the pons is your what are the parts of the brain? What do you name them? Cerebrum. Okay. Okay, fine. It also passes through the foramen ovale. Both your sensory root and also the motor root are passing through the foramen ovale. Note this point. To join the sensory root just below the foramen ovale in the infratemporal fossa. So, both your sensory root and motor root are passing out from the foramen ovale and later it will enter into your infratemporal fossa region. Note this point, it will be discussed in clinical anatomy part, okay. Thus forming the main trunk of your mandibular nerve. The mandibular nerve trunk is short, and after a short course again it will be divided into small anterior part and large posterior divisions, okay. Relation of your mandibular nerve. Medially it is related to tensor palati muscle and also to the aortic ganglion. Laterally it is related to the upper head of the lateral pterygoid muscle. Posteriorly it is related to the middle meningeal artery, and anteriorly it is related to the posterior border of the lateral pterygoid muscle. You can see here, this is the trigeminal ganglion. You can see the sensory root and also the motor root of your mandibular nerve joining together to form the main trunk of the mandibular nerve. Again it will be divided into anterior division and posterior division, okay. So these are the nerves or branches of your mandibular nerve. Okay. This is all about the maxillary artery, mandibular nerve and also the muscles of mastication. Again you will be covered these topics in the main classes. This is just an introduction. You just have to know the name of all principal and accessory muscles of the muscles of mastication. You have to know the 3 divisions of maxillary artery and their branches. First part will give 5 branches, second part will give 4 branches and third part will give 6 branches. You should know the names. And next the topic is mandibular nerve. It has 2 roots, sensory and motor roots. It will combine together to form a main trunk. Later again the main trunk will be divided into anterior and posterior division, and mainly your mandibular nerve supplies your all muscles of mastication. These are the few important topics you have to remember. And remember, mandibular nerve will pass through the foramen ovale and later it will reach us to your infratemporal fossa. This is one more important point. So any doubts in the temporal and infratemporal fossa mainly? Any doubts in the? No doubts in these 2 topics? This session is mainly for temporal and infratemporal fossa. So just let me know if you have any doubts now only. Any doubts?